Hello everyone, greetings from India. I'm happy to have this opportunity to present the basics of embryology and assisted reproduction. This presentation has been simplified as much as possible and is mostly for the benefit of intended parents. I apologize for not being present in person due to professional commitments. However, I wish the conference a grand success and I hope to visit your wonderful country sometime in the near future. So let's begin with Embryology 101, the basics of embryo development in an IVF laboratory. Embryology in Greek means the unborn embryo. It is the science of development of an embryo from the fertilization of the ovum to the fetus. In a routine ART setting, we create embryos by fusing sperm from the male partner and egg from the female partner. IVF, which is commonly known as test tube baby, as we all know, is one of the most significant advances in the field of modern medicine. The first IVF baby, Louis Brown, born in England in 1978, was the result of more than a decade of research by Messrs. Steptoe and Edwards. They essentially changed the rules of how people can come into this world. The technique that they pioneered made it possible to make conception outside the body in a petri dish. The technique has resulted in the birth of millions of babies worldwide since, several of which are multiple births. Initially, IVF was developed for women with tubal disease, but now it is the treatment of choice for several other causes of infertility. Since its introduction, all the steps of IVF have been improved, which has resulted in continuously rising success rates, as you can see in that graph over there. IVF has also now become the platform for the development of several other treatments, including egg donation, gestational surrogacy, and pre-implantation genetic diagnosis. Now, what are the steps in IVF? We basically start with the clinician or the fertility expert who plan the ovulation induction in the female partner. The major protocols are the down-regulated or the antagonist cycles. I will not go into much details of ovulation induction. I will leave it to the rest of my esteemed colleagues at the conference. Maybe Dr. Shivani from New Delhi can help explain that in detail. Oocyte retrieval is performed under vaginal ultrasound guidance. After the ultrasound is placed in the vagina and the ovarian follicles are located, a needle is directed through the back of the wall of the vagina and directed into the ovarian follicles. As you can see in this image here, the fluid is aspirated and then examined by the embryologist to identify the egg or the OCC, which is known as the oocyte cumulus complex. You can see in this image, the egg is in the center surrounded by the oocyte cumulus complex. During normal fertilization, the acrosome of the sperm releases enzymes which disperse the cumulus cells, thereby allowing the sperm to penetrate and fertilize the egg. Once the eggs are retrieved, they are placed in culture media, which is added with nutrients and then placed in the incubator. The procedure is performed, the egg retrieval procedure is performed under general anesthesia or sometimes sedation and local anesthesia, and generally takes 10 to 15 minutes to complete and not more. The complications with this procedure are minimal and are mostly related to general anesthesia, if any. Sometimes, very rarely, bleeding can occur at the time of the egg retrieval procedure, but this can be easily managed in the hands of an expert. Another important step is oocyte insemination. After the male partner produces the sperm by masturbation, the sperm concentration and motility are assessed under a microscope. After that, the embryologist will decide what kind of sperm processing is needed. Usually about 50,000 motile sperm are placed around the egg, as you can see in this image here, thereby enabling fertilization. The next step is of denudation. Denudation is a process which enables the embryologist to identify whether fertilization has occurred in the oocyte or not. It is done with the help of stripper tips, and it is usually done 10 to 12 hours post the insemination procedure. The next step is of embryo culture. Once the identification of the fertilized oocyte is made by looking under the microscope and identifying 2 pronuclei and 2 polar bodies, as you can see in this image here, The fertilized embryo is placed in the incubator by adding nutritive media to it. The incubator, a standard incubator would look like that. Depending on the laboratory requirement, the sizes would vary. That is how a Petri dish looks like. It is the droplets in the center are the media droplets in which the oocyte or the embryo is placed, and this is overlaid with oil to prevent contamination and change of environment to the gametes. The next step is that of embryo transfer, which is usually performed 72 hours after egg retrieval, which would be day 2 or day 3. Generally 2 to 4 embryos are transferred into the uterine cavity under ultrasound guidance. This is how a embryo transfer catheter looks like in general. There is an outer sheath and there is an inner sheath. The outer sheath is placed by the clinician inside the uterine cavity, and when the outer sheath is in, or the outer catheter is in place, the clinician will usually signal to the embryologist to load the embryo and transfer into the uterus. Usually, how many embryos do we transfer? It all depends on the woman's age, the cause of infertility, previous pregnancy history, and other factors, including the acceptance of twin pregnancy to the parents. When it comes to surrogacy, it's a bit of a maybe a controversial topic, that should the surrogate mother be allowed to carry twins, or should it be restricted to single embryo transfer? We prefer to transfer a single blastocyst, but then it varies from clinic to clinic and clinician to clinician. Ultrasound guided embryo transfer has changed the way embryo transfers take place now. Earlier, it was difficult to know where the outer catheter was in place, whether it was very near to the fundus or very far away from the fundus. Ideally, the outer catheter should be placed just below the tip of the fundus of the uterus, and an ultrasound can help us locate the presence of the outer sheath. ICSI, intracytoplasmic sperm injection, has been a major boost for assisted reproduction. Earlier, when males were having very poor sperm count, or a lot of abnormal sperms in their semen, or very poor motility, they had no option but to go in for donor insemination. But since the advent of ICSI, people with just a few sperms can father their own genetic child. So basically what you do in ICSI is that you inject a single sperm directly into the oocyte, as you can see in that image. However, there is a note of caution here, is that males with severe oligospermia, which is very low sperm count of less than 5 million per ml, should have a chromosomal karyotype performed, since they might be at a greater risk of chromosomal abnormality. What are the procedures related to IVF? Frozen embryo transfer. Now routinely extra embryos are cryopreserved by standard freezing or vitrification, and can be transferred in the next cycle after spontaneous ovulation or creation. This is done by